Hello, everybody. Dr. Chestnut here again. I just recorded this video without sound. That's the second time I've done that. So, yeah, book smart, I guess. Anyway, this week I want to talk about the importance of moving well and exercise. You know, as you probably are aware by now, my trademark term that I've been teaching in around the world and getting practitioners to sort of use as their sort of foundation of their evidence-based lifestyle advice to patients and me speaking directly to lay public is eat well, move well, think well. And the reason I used that term and trademarked it so many years ago was because I wanted people to understand that you had to eat well, move well, and think well at the same time for a period of time in order to get and stay well. That there's no point just looking at nutrition and not exercise, or exercise not nutrition, or either exercise and nutrition and not the importance of psychological fitness and emotional resilience and those things. They all go together. And so, anyway, a couple of videos ago, and in fact, on a few things I've written, I've talked to, extensively about the importance of vitamin D and why vitamin D is so important in terms of that initial innate immune response to kind of wipe out that invading pathogen or virus, and how the research is so clear that vitamin D is really important in terms of upregulating the innate immune response, that those innate immune cells have receptors for vitamin D, and they require vitamin D attached to those receptors so that that vitamin D can then be taken inside the cell and create an epigenetic change to upregulate the immune function of those innate immune cells. And that if you're deficient in vitamin D or vitamin A and D, we talk really how both of those receptors, the RXR and VXR receptors, are really upregulated. The vitamin A and vitamin D upregulate and regulate each other as well. So very important to take those together. I talked a lot about that, and also the importance of omega-3 in the immune function as well. And then the other really important thing about vitamin D that I talked about was how vitamin D is really important. So one of the things, just again to bring this back to COVID a little bit, is that what we're really learning more and more as we go here is that it's this hyperinflammatory response that's really the cause of this serious illness and the breathing problems. It's this hyperinflation in the lungs that's really leading to these deaths and hospitalizations. So one of the most important things that happens is if you don't have proper immune competence, what happens is when your innate immune system then isn't able to overcome this virus when you're first exposed to it. So then what happens is you create a more robust and more hyperinflamed response to this thing, and using your adaptive immunity, your T and B cells. But one of the most important things in with respect to that is your Treg or T regulatory cells, because your T regulatory cells are in charge of making sure you don't have a hyperinflammatory response. But again, these T regulatory cells, they have vitamin D receptors, and if they don't have enough vitamin D to attach to those receptors, they can't function properly, and therefore what happens is you get that overinflammation, you get that hyperinflamed response. Not to mention the fact that people with comorbid conditions, which we've talked so much about the importance of those, they're all basically have low-grade systemic inflammation. That's really part of most of these chronic comorbid conditions, or and a significant part. And so that's why omega-3 also is important with immune system and down-regulating inflammation, because when you're deficient in omega-3 fatty acids, you also can't control and regulate your inflammatory response. So you're hyperinflamed all the time. So no omega-3, no vitamin D and vitamin A and D together, you're going to have a down-regulated initial response, and then you're going to have a hyper secondary response because you don't have the proper regulation and you're pro-inflamed. So that's really important. And so sort of talked a little, we've talked about that, but now, and you're going to see some really interesting studies coming out. There's some interesting things that have been published in the Irish Medical Journal about the importance of vitamin D and how it relates to inflammation, and this hyperinflammatory response and downregulated immune function if you don't have enough vitamin D. And there's a study being done just starting in Alberta. What frightens me about the study in Alberta, that a little bit I've read about, is that they're going to they have two groups, and one of the groups they've mentioned so far is that they're going to give two large bolus, they're called bolus doses of vitamin D to one group, which again, the literature shows in the British Medical Journal, a great systematic review, which I've talked about in previous videos, says when you give a large bolus dose like that, not only does it decrease the effectiveness, but it also increases the chance of an adverse effect from it. So when you give proper doses on a daily basis, you have much better results. So that's really significant. And they say they are going to have a group that has what they call a very low dose of daily. So if that's like the RDA of 400 IUs, they're not going to get those vitamin D levels up enough. So it could, I really hope that their daily dose is enough. I really hope they don't make that error. But anyway, what I want to talk about this week is the importance of exercise. So last month in my research review and my patient and public newsletters, again, if you want to get a free public newsletter, just go to eatwellmovewellthinkwell.com. You don't have to buy anything. You can just have a free newsletter. And those of you who are practitioners can go to thewellnesspractice.com and get my monthly research review and my patient newsletters. But anyway, last month, what I did for my research review was I went over and I did this study. So this study's published in the Journal of Sports and Health Science. And the title is The Compelling Link Between Physical Activity and the Body's Defense System. The authors are Neiman and Wentz. And this, when they say defense system, what they're really talking about is the body's immune system. And this is an excellent summary of the evidence regarding the importance of daily exercise in terms of immune function. So exercise, you have to view exercise the way it actually is, which is a required and essential nutrient. Your genes cannot epigenetically express proper immune function or proper organ function or proper any function without the stimulus of this essential nutrient called exercise. And people who are exercise deficient or sedentary are sick, period, because you cannot express health without daily exercise, period. There's no way you can do it. And there is no drug ever, and there will never be a drug which you can take which can provide the essential nutrient of exercise. Drugs might be able to treat some of the negative health effects caused by a lack of exercise, but no drug can actually replace exercise. So that's why lifestyle is so important, because lifestyle addresses the actual underlying causal factors, those independent variables that are causing the effects like illness and lack of immunity and all these other things we can talk about. So what I really like this paper, because it does such an excellent job at talking about the importance of exercise. But so some of the things they point out are things like what daily exercise does is it really first of all, it's a low level stressor. So your body gets really used to that, and in response to those low level stressors, your body actually kicks up the immune system a little bit. And it also increases circulation, so that the circulation goes through, your spleen and your pancreas and your liver and all your organs, through your heart, obviously, and your lungs. So you increase circulation, which is healthy and brings oxygen, gets rid of able to get rid of those toxins as well. But the other thing that does is it's called immunosurveillance. So what that means is that as you increase circulation, you have more surveillance and circulation with your immune cells. So if there is a pathogen present, these things that are these little armed guards that are circulating around your body are able to find those things and attack them quicker. So that's one of the really important ways. The other thing that exercise does, which is really important and very relevant to this COVID-19 thing, is, remember, COVID-19 is not deadly by itself. COVID-19 plus immunocompromise from comorbidity is deadly. So exercise really plays an important role in this, because the other thing is that we know that as you have comorbidity, your chance of serious illness and mortality goes up significantly, exponentially. And we also know that COVID-19 exponentially affects the elderly more than the young. Why? Because the elderly have less robust immunity. They're more immunocompromised. And I want to point this very important thing out, and you're going to see this in this paper, is that it's not simply age that decreases your immune competence. It's time under stress of unhealthy lifestyle. So there are lots of elderly people. Remember, even with COVID-19, the vast 80 or 90% of people over the age of 80 who get COVID-19 survive. So there is a huge difference within the elderly population of immunocompetence. But in general, the elderly have a less robust immune response, which is why they don't respond to things like the flu vaccine very well. Which is, so it's not very protective in that group. Which is why they say we've got to make sure other people don't bring the flu to the elderly. But one of the most important things to realize is that it's not just being elderly; it's the fact that the elderly have had more time living under the strain and stress of unhealthy lifestyle. because they've been around longer. And we know that the average lifestyle is very unhealthy now in the industrial world. So two things happen as you get older. This time under stress of unhealthy lifestyle, this toxicity and deficiency, causes more comorbidities, more heart disease, diabetes, obesity, all the other chronic illnesses. Chronic systemic inflammation is just rampant. And it also causes, together with that, a decrease in immune function. So what's really interesting about exercise is that daily exercise, just a 30-minute brisk walk, significantly improves immune function in all ages, including the elderly. And also, it significantly decreases the chance or the severity of these comorbid chronic illnesses, both of which are the main variables determining how sick one is going to get from COVID-19. So just imagine the power of exercise in this. And we've already talked about the power of omega-3 and vitamin A and vitamin D together, and how that significantly increases your baseline health and immunity. So I always say, imagine if people, and you'll see, if they just each day made sure they got sufficient omega-3, vitamin D, and vitamin A, and they got a daily walk in, imagine what that would do to the baseline health and immune function, and the reduced in risk and susceptibility of serious illness from COVID-19, from influenza, from chronic illness. Imagine what that could do to an entire population if we just got people to go for a walk and make sure they're sufficient in those nutrients every day. I mean, these nutrients are less than a cup of coffee, right? And a walk is free. So we have an enormous, they say there's a second wave of this thing coming as we get into the flu season again, and cold and flu season coming next fall. So imagine between now and then how incredibly important it would be to increase the baseline health and immune function of people with these very easily implemented and inexpensive lifestyle changes. And so I want people to understand and be empowered by that, because there is something that we can do to make a huge difference, a huge difference. And the other thing that's really important with exercise is that they show that the people who exercise regularly, adding a brisk walk decreases your chance of an upper respiratory tract infection, decreases the incidence and the severity by 50%, which is more than any vaccine or drug in the history of vaccines and drugs. And that's from a daily walk. It's incredibly important. Now imagine taking that daily walk and adding omega plus D sufficiency. So again, I always say, people, go to innatechoice.com and please start being sufficient in those nutrients in that specific combination that I put together, and please go for a walk every day. It's just so important and so inexpensive and easy to implement, and the benefits are overwhelming. The evidence of those benefits is unequivocal. The other thing exercise does is it actually it decreases that chronic systemic inflammation. Daily exercise really changes that, and that low-level chronic systemic inflammation, not only is that a huge factor in all the comorbidities and chronic illnesses, it's a huge factor in the hyperinflammatory response that occurs and that is killing people in COVID-19. Inflammation is at the base of not only the comorbidities, but it's also a huge causal factor in the actual death from COVID-19. So again, that's why vitamin D and omega-3 and a daily walk are hugely important as we're dealing with respect to overall general baseline health and immunity, but also specifically to COVID-19 and any other chronic any chronic illness. So the other thing that exercise does is that it actually increases the health of your probiotic bacteria. So even, hopefully you're taking the Innate Choice probiotic every day, but even if you are and you're not exercising, those probiotic or healthy bacteria will not survive the same without exercise, because your gut requires exercise as well. It's an essential nutrient for every cell in your body, including those healthy bacteria in your gut. They require you to be daily exercising. Isn't that incredible? And the other thing I want to talk about is that exercise has been shown unequivocally to change immune function as we age. It allows us to maintain a higher level of immune competence as we age. So really important. And it just so worries me when I think about people being locked at home, not being able to get out and go for a walk. When I think about the fear and anxiety that's being created around this, and I think about what we know that fear and anxiety do to your immune system. I'm going to talk about that next video. It's incredible. So, I mean, I always want people to understand that exercise is probably, a daily walk is without, I say probably, but it's actually without doubt the most effective intervention in the history of interventions from any healthcare field. in terms of wellness and prevention, and also prevention of chronic illness, and in terms of recovery from chronic illness or reducing the severity of these chronic illnesses. Going for a walk has been shown over and over again in the literature to, I mean, we're talking decreasing heart disease by like 80%, decreasing diabetes by 90%, decreasing obesity by 80 and 90%, decreasing chronic inflammation by the same level. I mean, it is incredible. And again, when you add that to a simple thing like taking those essential nutrients, you can just make such a profound difference. So one of the great thrills I have, although I hate travel, I love to be able to speak to people all over the world. And one of the neat things I do, other than just, teaching my certification program and just to practitioners, or just, doing keynotes for conferences for practitioners, is I get to speak fairly often to the public. So, one of my favorites was always Eau Claire, Wisconsin, because we had the second largest gathering in history in that town. The first largest being JFK, President Kennedy. And so, going to places like Saskatoon and filling a theater. Nelson in New Zealand, filling a theater. Filling a university lecture hall in Perth in Australia, or in Edinburgh in Scotland. These are some of the great thrills, and the reason they're great thrills, they're not coming to see me. They don't know who I am until after I'm there. I'm not a famous person. But what they're interested in is learning about the topic of lifestyle. And so I just want everybody to understand that this idea that people are not interested or they're too lazy to change their lifestyle is absolutely false. It's ridiculous. It's dogma, and it's dangerous. The reason people would not be interested in changing their lifestyle is because they've been told falsely that changing their lifestyle won't matter, that it's a genetic problem, that it just runs in their family, therefore it must be genetic, and therefore their option is to take a pill, that lifestyle change won't really matter. When the truth is, the evidence-based truth is, that changing your lifestyle will have a greater effect than any drug in history. And we know that a lack of exercise, sitting is the new smoking. Why? Because sitting changes. It completely shifts your autonomic balance. It shifts your epigenetic expression. It shifts your metabolism. It shifts you towards sympathetic dominance, and it shifts you towards, chronic illness, metabolic syndrome. We know that exercise is a required nutrient, and we know that adding exercise back so that people are sufficient has a greater effect than any drug ever studied. Why? Because, and we're talking every chronic illness, including cancer, diabetes, heart disease, obesity, the major killers here, the major comorbidities killing people with COVID-19, the chronic inflammation, is that exercise is a required nutrient to express health and proper immune function. And there is no drug, and there will never be a drug, that can mimic the effects of exercise. Never. So drugs can never replace what only exercise can give. Drugs can treat the effects of a lack of exercise, but they can't address the underlying cause. Remember those independent variables, those causal variables that are causing these effects, these illnesses. So the underlying cause of these comorbidities, of this chronic inflammation, is lifestyle. And that's just so important. So I'm going to share with you now, if I can do this, I'm going to try and click this button, see if I can do it. Nice. So I'm going to share with you 3 of the favorite slides when I speak all over, the things that I get emailed most about, the things that cause people to jaw drop and get people who have never exercised to start exercising because they just didn't think it was worth it. I just want to show you the benefits, the proven benefits from the literature. You can look at authors like Booth and Roberts in the Journal of Sport and Exercise Science, or the Journal of Applied Physiology. These are some of the best journals in the world. Booth and Roberts, 2 of the names. I should have had the little articles to hold up for you, but I just want to show you these are all evidence-based things that come from the literature showing the benefits of a 30-minute walk. And you can also look at the Nurses' Health Study, which is really incredible, showing that you can reduce diabetes by 91%, heart disease by over 80%. So anyway, these are 3 of my favorite slides, and just keep this in mind. This is from a 30-minute walk. Prevent up to 91% of cases of type 2 diabetes and obesity. Obesity is related to 300,000 deaths and $90 billion in healthcare costs per year. Prevent up to 50% of all cases of heart disease. Heart disease alone kills 950,000 people per year and accounts for 41% of all deaths. Just look at those 2 things. Those are the comorbidities that are killing people with COVID-19. Obesity, diabetes, heart disease. and chronic inflammation, which you'll see. Reduce the risk of stroke by 25 to 30%, prevent up to 50% of all stroke deaths, reduce congestive heart disease by 63%, reduce hospital readmission for heart failure patients by 71%, normalize blood pressure, reduce risk of developing high blood pressure, restore and maintain heart and blood vessel health, increase HDL cholesterol, decrease LDL cholesterol. Again, no drug has ever been shown to be able to have these effects. No chance. Because drugs cannot replace exercise. That's ridiculous. No drug can solve a problem caused by a lack of exercise. Only exercise can solve a problem caused by lack of exercise. No drug can solve a problem created by a lack of omega-3 fatty acids and vitamin D and A. Only those things can solve those problems. It's so important to understand that. Reduce risk of breast cancer by 60%. Yes, and not only that, now you add the vitamin D to that and the omega-3 fatty acids. It's incredible how important this stuff is. And it's so simple to do. I just don't understand why it's not standard of care everywhere around the world. It makes no evidence-based sense. 50% less pancreatic cancer in overweight people. 72% less lung cancer even in smokers. Reduce melanoma, that's skin cancer, by 72%. Prevent up to 50% of colon cancer. Reduce risk and improve rheumatoid and osteoarthritis. Prevention of osteoporosis, which is bone loss. Again, just the fractures from osteoporosis cost $38 million a day. The drugs do not work. Milk does not work. More dairy is not going to build bones. Sitting on the couch, drinking, taking calcium supplements or drinking milk, which milk doesn't even have calcium in it anymore naturally because the cows aren't eating grass, they're eating grain. So they have to put calcium supplements in the milk. So why take milk? Why drink milk? That makes no sense to me. Anyway, sitting on the couch taking calcium supplements expecting big bones is as ludicrous as sitting on the couch and drinking protein shakes and thinking you're going to get big muscles. What builds muscles? Exercise. What builds bones? Exercise. By the way, omega-3 and vitamin D also very important for building bones and maintaining bone health. Increase new bone formation, increase strength, flexibility, and balance, which decreases falls in the elderly, improves quality of life for everybody. No kidding. Decrease gallbladder removal by 20%, decrease gallstone formation, improve digestion, and decrease indigestion, including irritable bowel and ulcerative colitis, and all these things, all helped by exercise, no question about it. Increase immune system function, we just went over that. Increase macrophage anti-tumor activity, those are those cells of your innate immune system. Decrease all-cause mortality by 67%. People who exercise have a 67% less chance of dying. Decrease all-cause mortality by 50%, 61 to 81-year-olds. Prevent up to 47% of cognitive impairment. Prevent up to 62% of Alzheimer's and dementia. Yes, that's a walk. Read Ratey, R-A-T-E-Y's book. Why can't I think of the name of it right now? Anyway, I'll think of it. Ratey. Look it up. I'll remember it probably by the end of this. Better physical function in older adults. Decreased chance of ever being in a nursing home. Decreased rate of aging. Enhanced learning capacity up to 12 times in all ages, by the way. Increased serotonin, that feel-good hormone in people. Decreased depression by 20%, including relapses. Again, look at omega-3 and D added on top of that as well. Increased growth and healing hormones. Decreased stress and body breakdown hormones. And decreased risk of weight gain or obesity. I mean, that's from a 30-minute walk. And then you add the omega-3 and D, and look what we could do to baseline health immunity between now and the fall. Because these changes, in a couple months, you can make major, significant changes in baseline health and immunity with these lifestyle changes. Next week, I'm going to talk about the importance of psychological fitness and resilience. And in the meantime, stay well, and I'll talk to you next week.